towards the bacterial Sialadenitis. So basically the bacterial Sialadenitis we study about acute, and this is basically secondary to the obstruction or obstructive condition like calculus or formation of and the duct structure. In acute Sialadenitis, basically either there will be a calculus formation or duct structure. It is actually a localized, remember, single gland affected, mostly parotid. Parotid is mostly affected in this condition. Staphylococcus aureus, Staph pyogenes, Strep viridins, then streptococci, pneumococcus, actinomycetins, hemophilus species, and bacteroids. But number first is you should remember is this Staphylococcus aureus. Retrograde spread of the bacteria due to ductal obstruction. Basically, it spreads from the lower area. Retrograde area is basically if I make it this like this. My drawing is very bad, but just avoid it. Retrograde air spread is like from here. Okay, so it is basically due to ductal obstruction, means the duct is obstructed. Now reduce salivary flow rate as a predisposing to ascending infection from bacteria. Reduce flow rate is a very important factor in developing the Sialadenitis. It is also again painful, tender, swollen, and radiating the pain to the ear area. You can see here it is. If someone asks you how to represent a picture, so you can say sir, first describe the location, what is the location, then describe the size of this, then describe the shape of this, then see the surrounding area, see whether the any discharge is there is any discharge of pus or not on a cleaning. If you want to visualize and you want to tell them, okay, then again then you will do further then you will do further examination, like you will then palpation you will do the of that swelling basically. Okay, and then you will see whether what is the consistency, either it is fixed or not. Okay, now lymphadenopathy infection, there's an lymphadenopathy will happen it actually. Okay, remember it. Now in mumps, we have a very important was trismus. Here we have said that it radiated to the ear area. Okay, intra-oral swollen and red enlarged duct of the gland means, of course, there is an enlargement of the orifice of the duct. Purulent means the pus discharge is present, and scent expressed pus for culture and sensitivity and testing. Okay, send that pus to the culture and sensitivity testing. Leukocytosis, blood count, also do the leukocytosis. Okay, very important thing, leukocytosis. Treatment is antibiotics. You will give the flucloxacillin. Okay, flucloxacillin. In that basically you have given the mumps. In mumps we do not give any antibiotics. We just give like antipyretics for the fever, or analgesics for the pain, or basically I forgotten to tell you, there is a vaccine actually for mumps. It is actually for mumps and measles and rubella combined formed. That vaccine we give actually. Here we give this antibiotics which I have told you. Then remove the predisposing factor, means the predisposing factor was decreased salivary flow, so increase the salivary flow. Surgical removal of the duct calculus. If there is a obstruction, there is a formation of calculus, so you should remove that. Then hydration is very important. Stimulate the saliva by the saligogogues. Okay, then do the drainage, needle aspiration guided by CT scan or ultrasonography. Okay, so number one, always remember it. If there is infection, so give antibiotics. Number first you have to do that, you have to remove the that predisposing factor. That was it. Then if there is infection, so give like antibiotics, do hydration, and then increase the salivary flow, drainage do, and then do the surgical removal of the ductal calculus. Okay, then Sjogren syndrome is another predisposing factor to bacterial infection. Then we have chronic Sialadenitis. Before we have studied about acute. Now this chronic can be in parotid and some mandibular. May follow resolution of acute infection or without primary acute infection, means it can be resolved or either it can lead to the chronic form. Then again tenderness, minor swelling, sometimes redness or swelling of duct or papilla, purulent discharge of saliva, Okay. Then there's a minor dilation of ducts. Follow the radiography, follow up the minor damage due to calculus, and treatment is same that was acute. For give the antibiotics, do hydration, remove the predisposing factors. Okay, basically, and increase the saliva by saligogs. Okay, now, so the next is sialosis. Sialosis, remember it, it is a painless, non-inflammatory and non-neoplastic swelling of salivary gland. It does not cause, it is non-inflammatory condition. Second, it is non-painful, non neoplastic. It is actually a parotid gland swelling, and it is bilateral. It is basically actually hypertrophy of the serous acini. Okay, there is, you have to remember it, this happened, there is no other like silosis. The drugs which you can give it, like anti-rheumatics drugs containing iodine, or adrenergic drugs. Okay, you have to give it. Means these are, sorry, causes like anti-rheumatic drugs are caused, like they contain iodine or adrenergic drugs. Hormonal abnormalities can occur, like patient has diabetes or acromegaly. If the patient has seen, if the patient is a diabetic and he's saying I have no pain, no swelling, and I have no pain and no inflammation, but there is actually a swelling and diabetic. Okay, so it can be nutrition deficiency, patient is suffering from anorexia nervosa, or chronic alcoholism. Very important point. If the patient who comes with a swelling and he says I have no pain in this and no inflammation, it is not even red, but you see a swelling and he's saying I'm a chronic and alcoholic, so basically it is sialosis. Okay, now, basically, management, how to manage it. Acha, LFTs, do the liver function test, see the glucose level. For diabetes, see the growth hormone, if there is any hormonal imbalance. For okay, see that. Drug history, take a proper drug history, because antiemetic drugs causes, iodine containing drugs causes, then basically adrenergic drugs also causes this. Eating disorders, does he passing from any anorexia nervosa either. Basically, you should imaging, do proper imaging. If drugs are involved, do the drug basically withdrawal from that patient. Okay, very important thing in this. Basically, just remove the causative agent. You don't need to have basically to give any antibiotics or any, because there is no pain, so you don't need to give analgesic. There is no fever, so you don't want to antipyretics. There is actually no inflammation, no infection actually, so don't want to give antibiotics again. Just remove that basically predisposing factor. Next, we have a necrotizing sialometaplesia. It is not so much important, but you should know this is not so much common. If it is especially males who smoke a lot. So basically, there's actually a metaplesia again, and basically there's a tumor-like condition. Okay.